All right, good morning, everyone, and welcome. It's such an exciting day at Loretto Hospital. I'm Dr. Allison Iwerty. I'm the Commissioner of the Chicago Department of Public Health, and I could not be more thrilled to introduce the 5 people who are doing Chicago's first vaccination and the 5 people who are receiving the first vaccines in Chicago. As you'll hear, they come from 3 different hospitals and a range of different frontline hospital-based health workers. These are the people being vaccinated first in Chicago. We have a lot of volunteers step up, will vaccinate and be vaccinated, and these folks are the lucky ones to get us started. So what I'm going to do is just walk around. I'm going to have the person who is vaccinating introduce themselves, then the person who is being vaccinated, and move all 5 together. We're doing 5 because the way the vaccine is distributed is in the vial that comes 5 doses. So this is an example of a lot of the logistics of vaccines. There's a whole lot we don't see to get us to this point. Each of these people being vaccinated has been counseled, has gotten paperwork. The folks at the pharmacy have worked to make sure the vaccine is drawn up properly. The people vaccinating are getting trained. And all of this happens to ensure that our vaccinating process in Chicago is safe, all of the appropriate place. And so with further ado, let's introduce our person who is doing the vaccination. Just your name, your title, and your hospital.
Hi, I'm Dr. Nikhil. I'm the Chief Clinical Officer and VP of Operations at Loretto Hospital.
Hi, my name is Marina Del Rios, emergency physician. I work at the University of Illinois Hospital.
Right. Yep. Oh no, we'll do them one at a time. Yeah, sorry. We'll introduce, okay. We're going to introduce everybody first, not a problem. Okay, so we've got our first pair here.
Hello, Clark, Director of Emergency Services and Clinical Research at Loretto Hospital.
Great.
Hi, my name is Barbara Shields Johnson. I am the Director of Nursing Services at Loretto Hospital.
Good morning. I'm Krista, the management coordinator here at Loretto Hospital.
Hi, my name is Morris, and I'm an emergency nurse at the Loretto Hospital.
Good morning. I'm Dr. Abha Agrawal. I'm the Chief Medical Officer at American Hospital.
Good morning. My name is Elizabeth Zimney. I'm an emergency room nurse at Region American Hospital.
Great. So you've met our folks. I think we are ready. All right. We can move ahead. Waiting for the pharmacy test to bring the vaccine. There we go. Okay, perfect. So they're getting ready. I'll just explain the process a little bit. So we have people here from Chicago Public Health, the immunization program. We have both doctors and some nurses. A lot of history here in vaccination, have been working to make sure that the staff here all the information that they need. We also began distributing vaccine really today, and so the Loretto Hospital has also received more doses of vaccine that they will be able to store and start vaccinating larger numbers of patients. What's happening here? Basically, the pharmacy has already vaccine dose. Each vaccine dose includes a very carefully measured amount of vaccine mixed with something to dilute the vaccine. You might have heard the vaccine is stored in ultra cold temperatures, but it is brought all the way up to temperature before it is to anybody's arm. So, question that we get a lot. So, in each case, we check very carefully the timing. I mean, when the vaccine leaves the warehouse, is the warehouse, the manufacturer, or the Chicago Department of Public Health warehouse. We track very carefully the time, and we basically are ready to go. All right. Are we ready? So what we're going to do, the doctor is going to turn off the patient's arm. Very standard procedure, just like a regular vaccine. All right. We applaud. So we'll get a date on and move to our next pair. All right. And our third pair. All right. And our fourth pair, we ask the patients left-handed or right-handed, which arm they prefer. All right. Our fifth pair. All right. 5 vaccinations done. Thank you. Congratulations. All right. All stay seated. We have people stay seated for monitoring right after we complete vaccine. Be transitioning over here to some additional remarks on this exciting day. Thank you. Stickers here who have received their COVID vaccine.
Ready? You ready? All right, so thank you so much, everyone. And you can see and feel the buzz of excitement because of this historic day here in our city. So welcome, everyone, to Vaccine Day in the city of Chicago. This is truly an exciting and important in our city's history. I want acknowledge the leaders here with us today, starting with George, the CEO of the hospital, George. Jose Sanchez, the CEO of Norwegian Hospital, as well as Dr. Martina Del Rios of UC, Alderman Roger Boyer, who's the chairman of the Committee on Health and Human Relations, along with Alderman Mitz, also from the Great West Side, and State Rep LaShawn Ford, who's there in the back, who's also a board member. And of course, this is an incredibly exciting day. What we just witnessed is history in the making. It's a milestone in our history. I said to each of the payers, vaccinators, and their patients, they're forever now part of history in the city of Chicago. And I think they recognize how important it is for them and for our city. Excuse me. We have finally, at long last, officially taken our first steps in our long road towards COVID-19 back in Chicago. We've been this moment of taking this initial step, moving our city forward and hopefully out of this terrible pandemic that's caused so much harm and committee. As we announced last week, we will now be moving forward per federal laws. First, we witness our healthcare workers who are on the front lines and those that treat patients or who conduct health and medical procedures put them at high risk. Over the next few weeks, we'll be following that by giving priority to resident staff at long-term care facilities, followed by opening appointment-only vaccination clinics all across our city for other healthcare workers month and through January. Later on, we'll target workers serving in essential or critical industries such as emergency and then individuals with underlying health conditions that are 65 years on from there. So we still have a long way to go, a fact which I'll discuss in a moment. I do want to extend my deep and heartfelt thanks to everyone involved in making this moment possible, for the scientists, the chemists, and all who are involved in getting this vaccine to the trials, the people who participated in the trials, and there were a number of very diverse members of Chicago that participated in trials and continue to do so, but also your team. I look forward to Moderna's application for emergency use authorization and the behind it. It goes without saying, but I will say, all of these efforts are about saving lives and putting our entire world, not just our city and our state and our country, but our entire world on track. In a moment, you'll hear more details about citywide distribution from Dr. Hardy and others. Before we do, I want to hammer this point home. Widespread community distribution of the vaccine is still months away. While this is an important and hopeful moment, to borrow a phrase from another doctor, how we light at the end of the tunnel, we are still in the tunnel. We still have places where the terrible virus is wrapped the body, mind, spirit of so many. We're still seeing, unfortunately, a number of Chicagoans that are losing their lives every day as a result of this virus. So we have to hold these two things in our mind's eye. Hope and prospect of what the vaccine brings, but caution about the fact that we still are in the throes of this terrible virus, and we will be here, unfortunately, for months to come. So for us, it means that we cannot let our guard down. It means we must remain diligent and responsible about the things that we know. Wearing masks saves lives, period. Wearing masks saves lives. Not a partisan issue, not up for debate. Wearing masks saves lives. Social distancing, washing our hands regularly, staying at home, and avoiding unnecessary travel. And that, unfortunately, canceling our traditional holiday celebrations occurring now and over the weeks, just as we did in Thanksgiving. Chicago and non-Chicagoans alike must refrain from celebrating as if the virus has magically disappeared, because it has not. Whether it's Christmas, Hanukkah, Kwanzaa, or New Year's. There was an increase in our city COVID positivity rate and test cases following Thanksgiving weekend because not enough people adhered to the guidance. I say this to all of you. COVID-19 is still real. It is still deadly. It's killing Chicagoans and people all across the country and the world today. We remain diligent. We need to slow of this virus, and we only do that if everyone in Chicago step up more and continue to follow the guidance. We want to compound that we've seen with further risky, irresponsible behavior. And again, I understand that this is hard. It's hard for everyone, me and my family included, and especially for those who live alone. A few weeks ago, I came across a letter to the editor in the Chicago Tribune by a Chicagoan named Rodriguez. She asked at least, just my, we remember our residents who bear this during the pandemic. That today, Regina, gives you some hope. We are headed and trending in the right direction. But I say this to all those Chicagoans, I want you to know that we know that we are asking you a lot. Not only to save the lives of people that you love and care about, but everyone in Chicago will continue to be. In respect to the vaccine, when the time comes, we will be putting in place a program to ensure access to different steps, ranging from centralized sites such as to down the road, working with partners to deploy vaccine at trusted community settings. So vaccines will be a part of our reality. Community to support racial response team members. I will expand on this in a moment. It isn't part of our COVID-19 strategy. It is our strategy. No one taking an equitable approach to distribution by capturing the demographic information on actually the vaccine. Let me this point. If we are doing our job in an equitable fashion, we see the demographic information. So for every point distribution of this vaccine, it is mandatory, mandatory that you collect the demographic information of people that are getting vaccinated so we understand how you're rolling out this vaccine and make sure that we're doing it in an equitable fashion. It is absolutely essential. We're enforcing that mandate. We've talked to the governor about it. We want it to be state effort. The demographic information isn't optional. You can't skip it. You must complete it, and we will be doing everything we can to make sure that that happens. Gets us where we need to be without there being community. Now, there is an trust deficit nationwide when it comes to taking vaccine, particularly among predominantly African Americans and Latinx. In order to overcome that hurdle, which we and the hospital under know why the challenge is great, but it's a challenge we must conquer because, folks, brothers and sisters, we're the ones who are most proportionately suffering this violence. We are the ones who must step up and make sure that we are protected from the ravages of this violence. We've suffered greatly in the city, disproportionately so, which is why we need to make sure that the vaccine is available to our communities. In order to overcome these hurdles, here in Chicago, we've done working closely with community leaders and stakeholders to get the word out to our families about this vaccine. Its importance and its safety for all. This we chose Loretto intentionally. This is a hospital that serves those who are in need. This hospital alcohol to make sure that healthcare is actually delivered in an equitable fashion here on the west side, and make sure that that is a continued part of the distribution strategy. So we will be our city COVID-19 website, and so that we can now say we have the beginning of the end. But we still have a long way to go. We have to do our part. We need to make sure that we step up in this moment, in this time. But bless us all that we can see the light at the end of the very long and very dark tunnel. I'm watching this happen. I feel like it on Christmas Day. This is an incredible moment, and I am grateful for all of you for stepping up. I'm grateful for the incredible partnership we've seen across our system. This is our competitors, not in this year, and step up and done heroic work. I hope that the partnership, the level of great that has been exhibited, continues on post-pandemic, because what we have to be about is saving people's lives, making sure that people have good quality, affordable health care. So with that, I will now turn it over to Dr. Arty. God bless us all, and thank you so much.
Good morning, and it is a good morning. I think just following up on the mayor's comment about Christmas morning, there is nothing I wanted more for Christmas than a vaccine that looked like this. Yes. We have a vaccine that now has emergency use authorization from the FDA, and it's been recommended by the CDC. It has an excellent safety profile, and it has fantastic efficacy, meaning in the trials, it was 95% protective against COVID-19. That's better than we hoped for when we were thinking about vaccine development here. And I want to highlight that we care about the safety of this vaccine above all. You go to the website, chicago.gov/coronavirus, right up at the top, there are details about all the vaccines. But I want to highlight, keep on there, 17 members of the Chicago Scientific Vaccine Work Group. These are 17 Chicagoans who are really in vaccine clinical trials, disparities, bioethics, data analysis, infectious disease, pediatric, reproductive health, regulatory health. A number of times this last week, as the FDA was deliberating, and their goal was to look at this process with us, to help advise the city of Chicago. In fact, make sure that the FDA evaluation of Pfizer clinical trial data was rigorous, which they found it was, that it was grounded in science, that the benefits and risks had been carefully considered, and that the accelerated vaccine development, the fact that we have gotten here faster than anybody anticipated, did not sacrifice scientific standards or the integrity of the evaluation process. I've been watching this very closely. I have felt very confident in knowing that no steps of the safety process for approving a vaccine have been skipped. Know that safety monitoring will continue. But these 17 experts, and you can find their names on the website, concurred and helped us feel very confident here in Chicago that the process has been good and driven by science. So what happens next related to vaccine safety and follow-up? Each of these folks has received information for a program called vSafe, and that's a program that's voluntary. You can download to your phone, it takes your your cell phone information, and then daily for 7 days after vaccine, get a text message. We'll ask, are you vaccinated? Because we know in the trials that there are people with side effects, things like a sore arm or perhaps feeling some muscle aches, and you need data about that. These were short, they were not serious, were not long-lasting, but we want to understand after people have gotten vaccinated any potential for side effects. So though if they sign up for this, they'll receive a text every day for the first week, and then weekly for 6 weeks, and then there's a check 2 months, 6 months, 12 months down the line. That is just one piece of the safety monitoring that is ongoing. The trials are continuing. There's a lot of work behind the scenes. First and foremost, vaccine safety is our greatest concern. I have the pleasure of being able to talk to all 10 of these individuals before I started this process today. And I just want to say that I talk a lot about numbers up here usually, right? I talk about the fact that, yes, we still have 1,600 new COVID diagnoses every day in Chicago. Yes, we are still averaging 22 Chicagoans dying every day in Chicago from COVID-19. More than a week. And percent positivity, 12%. But the number I care about today is 5. 5 individuals who are vaccinated, and the 5 healthcare workers doing the vaccinating. Because these 10 people stand in for the 400,000 healthcare workers we have here in this who have been showing up every single since our first case of COVID-19 back in January. When I talked to them about why they decided to volunteer, I heard about the fact that they've been taking care of patients who couldn't be numbers by the bedside, hearing about the suffering, hearing about some of the sacrifices to make related to their care with their own families, making sure they're being especially careful related to personal protective equipment. These are folks who have been taking care of Chicago, and I couldn't be more thrilled that the center of our Protect Chicago campaign, the vaccine, starts with these. A round of applause. Highlight representatives from 3 of our hospitals today, from UIC, from Norwegian, and from the Loretto Hospital. We have 34 hospitals that are all beginning vaccination over this week. These 5 doses were the first 5 of the 23,400 doses that the city of Chicago expects to receive in this very first week. That is our federal commitment, and it is being received. The first doses got to Chicago less than 24 hours ago, delivered to the Chicago Department of Public Health. We are ready to go and get started. We expect additional doses arriving over days. Many larger hospitals are getting vaccinated directly from the manufacturer, but we fully expect to see all 23,000 doses here in Chicago this first week, and then to see week after week. Already today, the preliminary information has been released about the Moderna vaccine. It looks really good too. The FDA will be making its deliberations on Thursday. The CDC will follow, and we're hoping that less from will be add a second safe and effective vaccine to arsenal. So we're only going to grow from there. As you heard the mayor say, we're starting with healthcare workers, hospital-based healthcare workers. We will shortly, just within the next couple of weeks, be expanding to long-term care facilities, both staff and residents there. And then we're expecting by the end of early January to start also moving into the space of outpatient healthcare providers. But as you heard the mayor say, it is going to be a number of months before vaccine is widely available. You will see that each of these people who got vaccinated did not take their mask off, and they will not take their mask off because he needs a second dose of vaccine coming in 3 weeks. And even after that, a lot that we will be continuing to learn about vaccine. We're going to be wearing masks, doing our social distancing for months now as we continue to roll out this vaccine. But this is, I fully the beginning of what will be the end of COVID-19 here in Chicago. We've already done this for nearly a year, and I think we're going to be at it for probably another year by the time we really get to the point where this is in the rear mirror. But it is within our power to keep this virus in control. You know the things that work. Please continue to do them. Be giving updates, not just about COVID cases and our positivity. We're being able to give updates about vaccine numbers. And I want to thank each of you and all the healthcare workers in Chicago who are at the very forefront of what is going to be our campaign to protect Chicago. So happy Vaccinations Day. And with that, welcome George Miller to Loretto Hospital.
Good morning, and thank you for that ovation. I really appreciate it. On behalf of our directors, our medical staff, senior leadership team, and we have board members here, Representative Sean Ford, we to the Loretto Hospital and the Loretto Hospital experience, and hopefully you found us warm, friendly, smiling, and with masks on, we're required to smile. We are really honored today that the Honorable the Chicago and Commissioner of the Chicago Department of Public Health, Dr. Arwood, chose the Loretto Hospital for this site and this historic occasion. Unfortunately, too long, African Americans and Latino Americans have suffered the brunt of inequity and disparities in health care. As an example, prior to COVID, if you lived in downtown Chicago, life expectancy was 8.2 years of life. And we couldn't open these curtains because of the cameras, but you can see downtown Chicago over my shoulder out the window. But if you come just 20 minutes drive on the Eisenhower, the exit 23B, that number drops down to 68.2 life. You lose 20 years in 20 minutes, that's wrong. And that's the Loretto Hospital mission to change that equity disparity. That's who we are and what we do. Then COVID happened, and we saw the disparity and inequities in healthcare live and live in color. African Americans, Latino Americans were dying at twice the rate, twice the rate of the rest of the community. We thought it was wrong. My colleague, Mr. Jose Sanchez, and I wrote a letter to the president of IHA and said, this is wrong. We have to do something about this. So we are a part of a committee dealing with inequities and disparities of healthcare statewide for the first time in the history of the Illinois Hospital Association. Co-chair a committee together, my colleague, and we're going to address this issue. We're so very thankful that the mayor and the commissioner recognize inequity and the vaccination here at the Loretto Hospital. I'm honored and pleased to say we have a cure for vaccination. However, there is no vaccination for racism, and we have to deal with that and deal with it head on, and that's why we are here. But here, because we've gone to help the vaccine here today, and there's a particular doctor I'd like to highlight, and Dr. Kizzy Corbett. Dr. Fauci said that she is the leading scientist at NIH to help develop the cure for that. She is an American woman. We're very cognizant of the problems that plagued us in the past, like the issues at Tuskegee Institute, and the fact that Henrietta Lacks, whose T cells were used to create a University, and that's why this issue, questions about have come up. We are here to say that we are going to be, we're going to assure you, and we're going to have conversations, we're going to talk, we're going to have open mics to ask questions and give you all the facts and the information, as Dr. Arwood said. We will continue to provide factual information, show you the science. This is why it's important to vaccination. Now, through rigorous tests, there have been thousands of Americans who have gone through a test. Zero have died. Over people have died from COVID. So, 319,000 people dead from COVID virus right now. So, I want to say that starting 3 years ago, my chief operating officer and CFO, Dr. Nasha Mitchell, and I sat down for out a strategy of how we improve the life expectancy here in the Austin community. We wrote it on the back of a napkin. And that napkin that Dr. Nasha has, we talk about doing medical reach, doing medical information, and also becoming a teaching hospital. And we have partnered with Dr. Ali and Affinity Health to do medical research. Dr. Abwadi knows that we have been approved by 3 different pharmaceutical companies to do medical research right here at the Loretta Hospital. We invite folks to sign up. Dr. Lois Clark is our medical director. She's been the face of our ED for 20 years. She's board certified in ER physician. She is someone you can trust. We were doing medical research, double-blind, FDA approved. We're the hospital in our state of Illinois. Double-blind trials. And although we're pleased and thrilled that Pfizer, Moderna, I'm sorry, come to the door first, you will in that conversation. We will be doing trials right here at the hospital. So if you know someone who will sign up, we're going to give them a stipend. We'll pay for all of their health care, the 2 years of the study, and they'll get that health care for free right here at the Loretta Hospital. And I am going to take the vaccination because I believe that leadership is leadership does. When it's appropriate. We certainly want our vendors first line to take it first. And also, again, I want to highlight the fact that all of our team members here are heroes. Like firemen who burn the building, they come to this facility and all the other 30 facilities like Norwegian American, and they take care of patients who are sick. And we do that every day, knowing that folks have COVID and
of our lives remains intact. And now it's time to turn the page, as we've done throughout our history, to unite.
But Biden also gave his rebuke yet of President Trump's allies.
Outside. Greek church was very kind, allow us to move in the parking lot, bought a bigger tent that's heated. When Chicago, from Texas, Chicago gets a little cold in the winter. There's snow outside, and it's cold, but we have a heated tent now. We're doing there, continue to do until we arrest this. So, Mayor, thank you very much. Commissioner, thank you, Mayor. Also, Alderman Mitch, thank you very much. I'd now like to turn this over, thank you for that standing ovation, turn it over to my colleague, Jose Sanchez, the President and CEO of Norwegian American Hospital.
Thank you, George. And it's hard to match that passion that George has. Witnessed this on a regular basis as we work together and from the front, especially we coach the health equity committee or the board of the Hospital Association. But I just wanted to say that today is really a great day, and a day that of special healthcare workers. And it's a blessed day because we have been able to come up with things that provide that our healthcare workers need to fight this pandemic. But also, I also wanted to say thanks the healthcare community, because I was one of those that actually suffered from the 19. And several days out of work, it was scary. All of you took care of without having vaccine or any medication to work. So I want to applaud you for your work, dedication, ensure that people are still standing in front of you. So thank you for the way you have done. As you know, I am the president and CEO of Norwegian American Hospital. For our hospital, I want to thank George Miller, president and CEO of the Loretto Hospital, for inviting me to be part of this very special moment in the history of our city and our country. With me is Dr. Agarwal, who is the chief medical officer for our hospital, who actually left Chicago back again twice. She loves Chicago, so welcome, Dr. Agarwal. I especially want to extend my deepest appreciation to Mayor Lori Lightfoot for her strong leadership of the city of Chicago through this pandemic. Mayor, thank you for the work that you do. We are all much safer due to the efforts of the mayor, who has pushed forward across the city needed to fight this pandemic. The arrival of this vaccine represents a sense of hope for the city and workers. Our workers are taking on this pandemic through patients that are very sick, so we are to implement our vaccination plan. In the hospital, we are fully prepared in our vaccination implementation study with healthcare actually this week. We are expecting to receive the first hospital from the Chicago Department of Public Health. And I want to thank you for your leadership as well, getting us what we need to ensure healthcare workers are saved. We have developed a comprehensive vaccination implementation plan that includes a tiered vaccination protocol that strictly follows the Chicago Department of Public Health. Black communities are affected more than anybody else, and you heard that from Marky George Miller. The city positivity rates, and I could be correct, is somewhere between 10% to 12% of those that we test. But when we do the analysis of those who we test in Humboldt Park and Norwegian American Hospital testing site, it's 4%. Okay? So that kind of validates what we have said all along in terms of the health disparities, as well that those who are minorities are actually with this pandemic. So moving to what healthcare functionary staff to eliminate these safety fluids, we have combined our advocacy efforts with the health leaders, service agencies, to ensure that we make a difference and begin those long-standing inequities in our country. In closing, although 2020 has been a challenging for all of us, I want the city of Chicago to know we are here and Norwegian American to work with you and to support you, making sure that our citizens are safe, that we have an opportunity to access to health care. This vaccine is going to be everyone. Looking forward to ensure that we will come back to some normality in our life, in our of everything that we have earned through years of hard work. So on behalf of the board and the Norwegian American staff, I want to thank all of you for your work and dedication, especially our leaders. Thank you. As Commissioner, and George and I are the voice of these hospitals. No one is our role to be an advocate.
Now we're going to Dr. Maria Del Rio.
Commissioner for honor to be here. In process in this year, this momentous year of 2020. It's really important to stand here and to take this moment in history. As an emergency physician has been on the front lines of this stage one, our workers have been anxious for this day to come. Especially those of us who identify with and serve in Latino communities, lost co-workers, and family members. We worry about our capacity to keep our patients safe in the setting. We worry about bringing COVID home to our families. We worry about getting sick and becoming a burden for our co-workers who will have to cover shifts while we hopefully recover. We've witnessed too many of our essential workers, the backbone economy, many of them undocumented, choosing to die at home because of concerns of healthcare loss, fear of being deported, fear of not having their families at their side during their sickest days. Their stories stick with me when I return home from a shift and make me pause before making it into my house to allow myself to cry the tears of anger, frustration, and sadness that I don't want my kids to see. But we can, doing the best we can with the resources we have. As we say in Spanish, son. There is an end point. There is a light at the end of we are now having open and honest conversations about justice. The COVID-19 pandemic brought together a remarkable cross-sectoral partnership of key leaders, elected officials, health experts, and workers to meet the urgent challenges of the devastating public health and economic impact among our Black communities. As a member of Illinois Widows, I can attest a large heart evolved to address both immediate and long-term challenges by Latinos case, but I know that this is a lot of our Black communities to address the causes of inequities the pandemic broke, exacerbated, exposed. I'm honored to use my emergency physician, University of Illinois Hospital, and as a Latino, I take pride in representing the work of those and the Latino community as we work alongside city leadership to ensure that we have an effective engagement plan for communities of color, a distribution plan with equity. It's been a challenging year, but we've learned how to mend hearts. And if I could say the same remarks in Spanish for my Spanish-speaking community. contribuyendo a este momento. Como médico de urgencia al frente de la batalla durante esta pandemia, puedo dar fe que los trabajadores de la salud hemos estado ansiosos por la llegada de este día. Muchos de nosotros, especialmente aquellos que nos identificamos y servimos con las comunidades negras y latinas, hemos perdido compañeros de trabajo y familiares. Nos preocupa a nuestros pacientes cuando los hospitales están sobrecargados. Nos preocupa que un día lleguemos a casa e infectemos a nuestras familias. Nos podamos enfermar y que nos convirtamos en una carga para nuestros compañeros de trabajo, quienes tendrán que cubrir los turnos después que nos recuperemos. Hemos visto a nuestros trabajadores esenciales, la espina dorsal de nuestra economía, muchos de ellos indocumentados, que han elegido morir en casa por no enfrentar los costos excesivos del cuidado médico, por temor a ser deportados, y que temen no tener a sus familias a su lado de sus días. Ellas se quedan conmigo a casa de un turno y me hacen pausar, llegar a mi casa para permitir las ira y tristeza que vean. Seguimos adelante, haciendo lo mejor que podemos con los recursos que tenemos. Con mi lengua materna, de tripa corazón. Esta vacuna nos da esperanza de que hay un punto final de esta incertidumbre activa, una luz al final del túnel. Si hay un lado positivo para este año 2020 es que ahora estamos teniendo conversaciones más abiertas y honestas sobre la justicia social. La pandemia económico de salud pública entre los latinos. El enfoque de Illinois Unidos, en mi caso, ha funcionado para enfrentar los desafíos inmediatos y a largo plazo que enfrentan los latinos y las causas fundamentales de las enfermedades que la pandemia rompió, exacerbó y expuso. Es para mí utilizar mi privilegio como médico y como médico de origen latino, me enorgullece representar y a la comunidad latina. Trabajamos con el liderazgo de la ciudad para asegurarnos de tener participación activa de las comunidades minoritarias y un plan de inclusión de personas con enfoque en la equidad. Este año ha sido uno desafiante, pero nuestra comunidad ha demostrado que sabe hacer de tripas corazón.
Good morning. My name is Roderick Sawyer, and I serve as 6th Ward of the City of Chicago and chair of the Health and Human Relations Committee. This is truly a fantastic day. I want to thank the 10 individuals that are here today, the 5 recipients and the 5 administrators that this vaccine. This is truly, and I echo what Mayor Lightfoot stated earlier, this is a truly momentous occasion. It's kind of somber to me because I do remember not so long ago about inequities that have been experienced at the hands of Black people. The T-cell incident, the Tuskegee experiments. We have to remember these were not that long ago. They were not that far back. So as we look at these dark periods in our time, I will have to reflect upon that. But at the same time, when we look towards the light, no pun intended, we look toward the light and see that science is coming away, and one call from a lot of my friends, and the overriding call is asking, are you going to take the vaccine? People Bible verses to me, and saying all these things. Whole joke, but the joke is when a person stranded and someone came by and said, you need help to save me, another person came God will save me. The person died and he's before God and say, God, why did you? And he said, I sent 2 people for you. Same thing here. You know, we have to trust these wonderful signs to see that we have today. And I want to thank you, not just you today, and I think it was significant being at the hospital here on the West Side. As I heard the president on the news today about the disproportionate impact that COVID has hit the area. I think it's appropriate that we and answer to the question is simply yes. When it's my time, I will be happy to take the vaccine. I will be happy to let people know that I've taken the vaccine, and I will make sure that I'm monitored, as Dr. stated, to make sure we have accurate demographics information so that we continue on with this science. And as a believer, I'm a faith believer. I believe in God. I believe that God sent the scientists and doctors to provide this vaccine for us. Thank you very much.
And with that, I'm happy to take your questions.
Thank you, Mayor. Good morning. These are questions, of course, from others as well.
Yes.
Is Loretto Hospital actually the first, or are there being administered across the city today?
No, this is the first.
And what's the time frame and supply of those other hospitals?
I'll defer to Dr. on that, but we have the Department of Public Health is taking amount of time working with the 34 hospitals to have them first have the infrastructure needed to support the vaccine. I think this requires cold storage, so we've expanded the number of hospitals that have that reach, and then you've got a period of time once it's defrosted, make sure you get it to patients. But I feel very, very confident about the plan that's in place. And as the doctor already said, we got our first tranche of vaccines within the last day, and we expect to get the rest of the order that we placed this week as more vaccine comes along. As in we expect to continue vaccinating frontline health workers and then move to resident staff in long-term facilities. But I'd like to already give more details.
Yes, just briefly. So each week, the city of Chicago is allotted a certain number of vaccines by the government based purely on population. That first dose amount is 23,400 doses, and those being among the millions being shipped from the distributors. Came from Kalamazoo, Michigan, which happens to be the city where I grew up, so I love that as well. And it is arriving really throughout this week. And so we received the first doses of the Department of Public Health yesterday. We fully expect many hospitals that have cold storage are receiving vaccine directly from that manufacturer, and we expect a matter of days, if not already on the way. These are the first vaccines being given. CDPH start distribute process. I expect hospitals to really be vaccinating by the end of this week, and we are working with all of our hospitals, not just this week, but every week moving forward. We will continue to allocate vaccine week after week after week as long as our hospital frontline workers who need vaccination.
Does being vaccinated mean anything for the city's travel? Are vaccinated residents exempt?
No. So as I said, we are super excited to vaccination. There are not changes at this point related to travel order, related to wearing masks, related to social distancing. It is going to take months before we get to a point where we have Chicagoans vaccinated, that we start being able to think about how vaccine plays into some of those larger decisions. We will continue to follow the same strategies that we've followed all along. We'll be making reopening decisions based on numbers of cases, positivity, our ability to respond, how our hospitals are. But the good news is where we think about some risky places, our long-term care facilities, for example. We had thousands of cases associated with those facilities. So from the health department perspective, getting vaccines right along with care workers means we will start to see some improvement in cases in deaths and be able to move some of our response capabilities off of those high-risk settings into other. So as you know, we follow the guidance related to prioritization, but we were thrilled to really start with healthcare workers and long-term care facilities, and then we'll move from there.
Is there an update on the travel this week?
We will be putting out the update via an announcement. The only significant change time for quarantine will decrease from 14 days to 10 days, in line with the updated CDC recommendations. Other than that, we'll put out the updated map.
Thank you. Mayor, today, while you come to Loretto Hospital, the same there is a vote today on Mercy Hospital, shut in there. Could you react to that, please?
Well, I think there's a lot of concern that's been expressed by members of the community and various elected officials. I've had extensive conversations with them, and I talked to the governor about our concerns about the shutdown and really the larger implications, I should say, for our safety net hospitals who have been faced with a number of challenges, but particularly in this time of the pandemic. And my hope is that the legislature will actually take this up to get things on track and provide some support to the safety net hospitals. But Mercy is front and center today. And as I said, I've had extensive conversations with local officials and the governor raising questions about what Mercy's plan is, as a plan going forward, and I know it works.
From the Chicago Tribune, recognizing criticism and concerns that you, the governor, and others have had over President Trump's handling of the virus, is there any room to thank the president and the government's speed now that the vaccine is here?
Well, I think the thanks really goes to scientists, people at companies right line. Of course, the president and his team should to make sure the vaccine was online. Just for for example, just to people that that so a lot has been done differently, to and, you know, I've been very candid about my disappointment with the way we handled this pandemic. I think lives were lost. I know that people put through suffering and pain because there wasn't a comprehensive strategy. So we're here today celebrating this moment, and rightfully so, but still under this administrative watch, many of us here across the country are saying, where are the that are going to be needed to really maximize distribution of this as it comes online? We make sure that anybody who gets the opportunity to do it. So there's a lot. The criticism remains valid.
There are off-topic questions, including regarding the CBS story last night on the social workers' home. Why did the administration go to court to try body camera video from being broadcast, and why the administration asking a federal judge to punish this young sharing video of her own home being raided?
A couple things about that. That raid actually took place in February of 19, even before the 2 elections was not something that happened. But what I will tell you is, because of the concern that we saw and was expressed, we changed the protocol for search warrants. There was a pre-check location. And I'm going to sit here and tell you that we've solved the problem, but we responded to what we were seeing was way too many circumstances of officers going into the wrong home. And I watched the video, and I put myself in that poor woman's place and thinking about somebody breaking into your home. They are in the middle of the night and with a child in the and that cause. So taken steps to address that issue. Now, this case was litigated in federal court. The federal judge put in place an order. There's allegations that she has violated that. What I in my law department to do is, with respect to this one, if there is a pending case that is resolved, we're looking across other litigation before we took off. We got to stop and we got to clean it up.
COPA has not yet made a decision in 22 months on this.
I just, look, I want to be here because I respect the independent. But give me a break that we didn't put the ridiculous. It really is.
On the PGA, why it was appropriate to personally intervene on behalf of a campaign donor as the district was looking for vendors to buy computers for remote learning, and will continue to do these sorts of things for other campaign donors.
So what's missing from the BGA story, disappointing as somebody that has just to be good government, is this. At the time that came in, it was at a time of the pandemic when every and their brother via calls, via text messages, saying, Mayor, how can I help? I know that gentleman, he is a good person. He reached out and said, hey, I know this is struggling to find devices. Can I be helpful? So I passed on that email. Look at my emails from the time I was probably getting 10 or 15 a day from people across the city of goodwill saying, Mayor, how can I help? PA, I have access to other things that are needed to fight the pandemic, and I have access to devices that us. Recall, we had about 3 days notice before CPS was shut down. I have no forwarding that information. I didn't even remember the I saw be obviously expectation with that and anything else is the proper vetting, the proper process is going to be followed. I assume that that's what happened. Honestly, I haven't talked to him since that email. I think I didn't talk to CPS about it other than, hey, here's a person who says they want to forward it on. And like I said, at that time, lots of people of goodwill across the city were reaching out to me and the administration and offering to help. And so I feel comfortable that we pass the information along, whether it was to CPS, to OAMC, others, and then a process of vetting and making a determination happen.
Back to the video is to follow mentioning the woman or not video.
I can't comment on that. Federal judge put rules in place for that judge to determine whether or not that was appropriate. I'm not going to say second guess a federal judge. It sounds like some control over how the information to that matter is handled. That judge no is very competent, and I'm sure will be fair in assessing whether or not the rule violated.
From Craig Delamore. Oh gosh, Fran will kill me. You got to give me one for Fran.
We can.
Okay. Craig first.
Fran gets a question. Usual 5.
All right.
Okay.
From Craig Delamore first. Can you react to reports the coming Biden administration is willing to compromise on a coronavirus relief package that does not contain aid for local government?
I'm very disappointed with what I'm seeing as the developments, and I don't know that that's the incoming Biden administration as much as it is what's going on in the Senate. You've heard this now many times over many months. This virus has had a disastrous impact on economies, local, state, all across the country. This is not something that should be partisan in nature. Every city, whether Democrat controlled or Republican controlled, whether controlled by independents, and no how a move and get to the president's desk for signature, and there would be zero relief in federal, state, and local government. Absolutely unacceptable. $800 million loss in 2020 alone. $1.2 billion budget deficit in 2021, $60 of which $703 million related to the impact of COVID-19. This has nothing to do with long-term life or patient issues. It has to do with the COVID-19 has wrecked our economy. And you're supposed to just stand here with nothing, no hope from the federal government, and accept that? It's okay. Absolutely not. And I have everyone that I can talk to, I have made it very clear to our senators, this is fundamentally unfair, unacceptable. I expect our federal leadership to stand up why state and local funds absolutely must be of a stimulus. If we give in Mitch McConnell on so many issues, the floor, we are setting a dangerous for the future that will make the new administration's work that much harder. That is, if Mitch McConnell draws a line, no matter how reasonable, you're going to compare this heartless man done so much harm to our country, whether it's the judicial system, whether it's being complicit in all the nonsense that has come out from President Trump, particularly today. That's the follow his lead? I don't think so.
Fran Spielman at the Sun-Times efforts to rename Shore Drive in honor of Double, if not, why not?
Support is overdue to acknowledge appropriate to stop under our state. And so what we have done is engaged in a conversation that is ongoing. Those who are advocating for different things, not the least of which is a monument to memorialize DeSable. We will figure out the appropriate way to honor the founder of our country, and we'll do it in a way that is collaborative and respectful.
One more from Fran, your proposal to a quick start special service along North Michigan Avenue, generate funds for all from Hopkins and Riley. That means it won't happen during a mistake given the dramatic drop in foot traffic.
I do think businesses in the downtown area came to us in light of the challenges that they experience and were facing over the course of the summer and the fall, asked for help, were willing to be asked. And what you saw is a manifestation of authentic prerogative at its worst. And so the question isn't to me, the question is to those who block the will of business community in their wards who are suffering and hurting and wanted some kind of relief and were willing to tax themselves. So what possible legitimate reason would there be? We work with the aldermen. We address every concern that they had, even as the goalposts repeatedly kept moving. So those places are left high and dry because of those aldermen. It's a mistake.
Can we have a vaccine? A lot of folks have been to also ask, where are teachers on the list of essential workers? When might teachers receive a vaccine?
I believe there are the second wave, but I will let Dr. Artie respond. Second wave meaning.
And might that help schools more into class?
Well, let's be clear. Look at the actual data and the fact. Dr. Artie has been very, very efforts in our to make sure our people are safe. And keep in mind, there have been people in school all year. Jailers, now some teachers who chose to teach their actual rooms, building principals. So we have an obligation to make sure that every single person who is in our building is safe, and we have met that obligation. We will continue to do so. Have to be our children. Okay, talking about where's the study after shows that. And what we have to hope is we give parents options. They can opt in, tell. The line has been drawn by the teachers union, which is to say, we decide and no one else. We decide, no one else. To give parents, many parents and students want to come to in-person learning, and there is no substitute in person learning. And which I wish they would think about, what is going to happen when our kids fall? What are we going to do? Is widening every single day. We have an obligation to children to provide them the best high-quality education, and we build a pathway back into schools because we know that has best results. All we are saying is parents should have options. Right. It is
Dr. where teachers fit into the vaccine.
I would just add as a reminder that here in Chicago, as anywhere it is receiving back from the federal government, we must follow the prioritization that's out by the Advisory Committee on Immunization Practices through the CDC. At this point, the only formal voted on recommendation has been for that phase 1A. That's is likely to be part of the conversation at the federal level to clarify on. We will be excited about vaccinating essential workers. We'll be excited about vaccinating teachers and others where we get there. But just echoing here, we are not in favor of waiting about moving ahead with school. Here in Chicago and internationally, repeatedly shown that with the practices in place, school is a safe from a COVID perspective for children and for adults. Mind you, we've had many schools open here in Chicago, private and parochial, and the Chicago Department of Public Health has done a lot of work every time there is a child, someone in a school setting diagnosed to do that investigation, and we found the rates of COVID children who were in school compared to the rates of staff. You take COVID seriously. We have we know Chicago Public Schools has taken it seriously. It is the right from a perspective to bring school back. Be a part of that conversation as it is available, but that's likely to be sometime later in 2021.
Thank you.